Welcome, everyone. My name's Kellen Klein. I'm the Executive Director of Citizens for Community. Raise your hand if this is your first C4C event. All right, some fresh blood. Excellent. Thank you for coming. Well, for those of you who aren't familiar with C4C, we are a local nonpartisan nonprofit that's working to foster a more connected community through civility, collaboration, and civic engagement. We host these community forums twice a year. It's an opportunity to roll up our sleeves and really dig into hot topics and prominent challenges facing the town. This is one that has been, kind of feels like one of those ever-present challenges, but has been coming more and more onto our radar of late, especially thanks to some advocates who are here in the room today who actually came together at a different C4C event about 8 or 9 months ago, and they're going to share some more about that history in a moment. But today's forum is focused on serving our seniors. What do we have and what do we need to help older adults in our community age in place, stay in this community as they get older? I want to start off by acknowledging some of our partners and supporters who have brought this event to fruition today. First and foremost, the Nugget. I saw the man with the yellow hat in here somewhere. There he is over there, Jim Cornelius. We are so grateful to the Nugget for their help promoting this event, collaborating, doing a bevy of articles by Sue Stafford, who also writes for the Nugget, talking about this issue. Raise your hand if you learned about this event from the Nugget. Raise your hand if you learned about it from the Nugget. Yeah, that seems about right. Over half probably. We are so fortunate to have a local newspaper in our small town. If you are not currently a subscriber to the Nugget, I strongly encourage you to be one and sign up soon. And if you haven't subscribed yet, I would also encourage you to check out Mr. Cornelius's long-form articles on Substack, Notes from a Small Town. That's another opportunity that you can support the Nugget. So thank you, Nugget, for your support. Also want to acknowledge our partner on this, Age-Friendly Sisters Country, another nonprofit that is a fiscal sponsor for people who want to get more engaged in the community but don't want to start their own thing. I see Judy Smith back here at the back. There's some Chris Lang, who's one of the founding members as well. Raise your hand if you're a member of Age-Friendly Sisters Country. There you all are. Mary Orton as well. Thank you so much for your support. This has truly been a collaborative effort, and we are so grateful for their partnership on this. Couple of funders who I want to acknowledge who have brought this together as well, or helped us bring this together: St. Charles Health System, the Ford Family Foundation, AARP, and the City of Sisters have all contributed funding towards this endeavor, both the research and the community conversations that happened before it, as well as the Senior Resource Fair that I'm sure all of you went to last month, as well as this community forum. So thank you to those sponsors for their support as well. All right, normally I would, yeah, we can clap for that. Thanks, Kris. I don't think they're here, but you know, I'm sure they're all watching on the live stream with bated breath. Normally at this point, I would invite you all to do a quick icebreaker, but we're going to have lots of opportunities for connecting with one another, which is core to our mission, a little bit later, because this is not like our usual forums. If you've come before, oftentimes you'll see people sitting up here on stage. We'll have sort of a panel discussion followed by Q&A. This one, we're putting you on, what's the phrase? I was going to say putting you on trial, but that doesn't feel right. But this is a bit more inviting all of us to get in the weeds, I guess you could say. We're going to start off with some inspiration, first and foremost from two C4C board members who are also co-founders of the SOS, Serving Our Seniors group from Age-Friendly Sisters Country. They're going to give a little bit of context around why this issue, what they've been finding through a lot of the research and listening sessions and surveys that they've been doing over the past 8 or 9 months. Then we're going to have some more inspiration from two speakers who have come from Redmond and Portland to share their wisdom with us about what they've seen be successful in other communities and what we might keep in mind for sisters and what might be possible in our community that we don't currently have. And then we're going to send you off to all these tables around the outside, and we'll give you a little bit more logistical information about that later. But this is an opportunity for you to talk about that subtopic under the Serving Our Seniors umbrella that feels most important to you. You do not have to be an expert in this field to participate in that discussion. Your lived experience is enough. What you care about is enough. This is an opportunity for us to think about what might be possible. Where might this go from here? Because we always view our community forums as a starting point, not an ending point for action. Last point on that, if you have not already found the card on your seat, you're probably sitting on it, and I'll let you awkwardly reach underneath you and try to find that right now. But there is a card with some opportunities for you to take action in the near future, to lean in further on this topic. You'll see that there's a website we've created, which is kind of a one-stop shop for information around seniors in our community and pointing out to the bevy of other resources that are available. There's also an invitation to join us for a debrief conversation at the Hub tomorrow from 12 to 1:30. That's our headquarters in the center of town next to First Street Park, the former chamber building, the former library, if you've been here long enough. We'd love to see you join us there. And there's one more thing on the card, which I am forgetting right now, and I'm trying to stare awkwardly at it over here. Wait. Oh yeah, subscribe to our newsletter. That's a great way to hear about other events that we're going to be planning on this. We are looking at doing sort of a workshop/book club on a book called I'm Dead, Now What?, which is the best title I've ever heard, that really helps you think about the planning process of preparing for life transitions. And we have not scheduled that yet, but if you subscribe to our newsletter, you will get to know when that is happening. That's kind of our hook for how to get people in on that. All right, I think that's enough context and introduction from me. I'd love to welcome up our newly inaugurated C4C board president, Kris Bergstrom, who's going to share some more about how did we get to this point and what are we doing here? And maybe with our lives too. I'd welcome your thoughts on that for me, Kris. Thank you. Give her a hand, yeah.
I had those same thoughts this morning when I woke up. How did we get here and where are we going? But I've been asked to give you a little background, maybe sprinkle some breadcrumbs and help you understand how we got here. Yeah? So when it became apparent that the lodge would no longer be able to provide comprehensive services, a small group of us met for coffee, as people do in this town, and we started to kind of think about the ramifications for our community and maybe even ways that we could support seniors who were now probably faced with the challenge of trying to age in place. So, Chris Lang, Sue Stafford, and Jane Paxson, come stand here. I know you're tired. We won't keep you up here long. They invited me to join them for coffee. And I don't know if this is a disclosure item or a trigger warning, but if you ever find yourself in line at FICA and they invite you to a table, know that you're going to be doing some, what do they call it, necessary good trouble, and you'll be going on an adventure. So we started SOS. And stand by because there's more. These women taught me about the history here in Sisters, where the community has been willing to step up to serve and support. So we took a page out of the playbook of the community of Sisters and maybe stole a little from Margaret Mead and decided to see what a small group of thoughtful, committed people could do about supporting seniors. After all, you may remember that in forums like this, in conversations and groups like this, STARS was born, Age-Friendly Sisters Country was born, and I even heard that at one point you put an additional wing on the elementary school, and all of those are still standing. We knew we needed reinforcements. So along comes Age-Friendly Sisters Country and Judy Smith, who said, we're behind you 100%. You can come up, Judy, or you can just stay in your seat and stand and wave. We knew that we needed somebody to help us with data and demographics, so Jane Killefer came to our rescue. And the whole time, we have been working under the umbrella of C4C. So we've had a lot of help, and I'm going to thank these folks after recognizing them for their good work and then invite you to sit down because I know how hard you've been working today. Thank you very much. We applied for some grants, and it won't surprise you that one of them came from AARP. You know, I used to laugh when that magazine came in the mail for my parents. We got a grant from the City of Sisters. We got some money from St. Charles. Some people took field trips to Portland. They did research on programs in Medford and Ashland. We went to Bend. We got busy. And our first step was to gather together a group of local leaders who had something to do with supporting seniors or working with seniors. They came together and they gave us great information about what was in place and what wasn't yet in place. We sent out surveys. We hosted listening sessions to hear from all of those who were affected. We met many people who color their hair the same way I do. We met many of their children. We met some of their spouses. And you can imagine there's a large group of people who are wondering what happens next as we make these transitions as we age. We analyzed the demographic data and trends. We hosted what I would say is a wildly successful senior resource fair just a couple of weeks ago. The thank you notes are still coming in. And all of this has been skillfully recorded and reported on by Sue Stafford and the Nugget, who remains an invaluable resource and partner for us. So as you can imagine, we learned a lot. We heard stories about needs and challenges and worries. So many people came to these conversations saying, I need to make a plan. And we nodded and realized that plans change as we age. There are so many people who haven't really thought about that. We met people who live way out of town and have too much land and too much stuff and don't know how to get out from underneath it. We met people who say, I need home maintenance and I don't know who I can trust to come in and help me. We met people caring for their spouses and their family members. We heard about isolation and loneliness and a longing for a central place to gather and be in good company. Many are living alone. Others rely on their neighbors. Some are unable to drive. But over this whole arc, what we were reminded from a friend of ours who is a specialist in this is that these are people who are wrestling with losing their sense of independence and ability to make decisions. You've seen the demographics on the slides when you came in. Right now, about 40% of us in Sisters, not them, but us, are seniors over 65. That number is likely to double by 2050. 4 to 6% of seniors are living under poverty lines. There are some resources in place. There are some services in place. And while we were listening, we heard countless expressions of gratitude for stars and Meals on Wheels and age-friendly sisters and Council on Aging, but more is needed. So that's why the proverbial breadcrumbs have led us to this place on this day in your good company. Thank you for coming.
Thank you so much, Kris. And one other person that I forgot to acknowledge, which is Starshine, which is a local summer camp provider and childcare provider, and they're providing childcare at this event, which enables a lot of you who I know all have young children to come, but including my own children and some other folks in the group as well. And we always want to make these events as accessible as possible, and Starshine helps us do that. So thank you. And tell your friends that there's free childcare. I mean, what makes a better date night than a C4C community forum? Am I right? Sloan, I know that's why you're here, right? Oh, single night, ladies' night out. Okay, got it. So now we're gonna move on to some inspiration, like I mentioned. And first and foremost, I'd like to invite up JoAnn Herrigel from Portland, all the way, drove over the pass just for us, braved the wind and weather and the balmy summer weather that we've got here. JoAnn is the former deputy director of Elders in Action. She's been involved with villages in Portland, or the villages, which is a unique concept I think she's going to share about. I won't steal your thunder anymore, JoAnn. Go ahead and come on up here and I'll get your slides ready. Please welcome her.
Short person. Can you hear me? Okay. Move this out a little bit. Whoa. How many of you are familiar with the game of Mahjong? Do you play Mahjong? Okay, the last presentation, public presentation I gave was on Mahjong, but it was in a Spanish class, and I had to do it all in Spanish. So this is going to be a cakewalk. we got it. So, no, you're good. We can. I see. Okay. So my name is JoAnn Herrigel. I've been living in Portland, city of Portland, for about 34 years, from the East Coast originally. For 20 years, I worked for a local government, and the name of which was Milwaukee, which is just south of Portland. And then for 3 years, or a little bit more than that, I worked for an organization, a nonprofit called Elders in Action, and we did advocacy for older adults, most generally lower income older adults, as well as we had a core of engineers that helped people with things like people would come to us and say, I'm being evicted, what do I do? Or I have bed bugs in my apartment, how do I handle that? Because that's a cause for eviction as well. So that was an interesting experience. That organization is now out of business, but it did a lot of really good work for about 20 years. And then in 2015, I was involved in a small group of people that was starting Eastside Village. It was one of 11 villages that was about to begin in the Portland area, and we also have one out by the coast and one in Vancouver, just over the boundary with Washington, with the state of Washington. And ours was the first to open, mostly because we had a small group of people that just said, when are we going to stop talking about this village and open it? So we opened it. I'm going to talk a little bit about the village and both the benefits and some of the things, a lot of the things that it does do and a lot of the things that it doesn't do. So second slide, Kellen. Okay, so as I said, a village, for those of you that are not familiar with it, and I'm sure most of you are, it is not a place, it's actually a plan for aging in place. So it's a group of people who pay membership into an organization, and in return for their annual membership, they get coordinated volunteer services. We have a core of about 25 to 30 volunteers that do direct services for people in their homes or provide transportation. Excuse me. And we also do household tasks and friendly visiting and a host of other things. The other thing that we do is we coordinate social events. So those are the two big categories. One is helping people in their homes age in place, as well as trying to get them out of their homes and keep them active while they're aging. We have an annual fee, as I mentioned. We have in 2015, we started with 25 members, and in 2026, I'm happy to say we're up over 220. And I think we're about the biggest village that is open at this point in the Portland area. As I said, we have about 25 to 30 volunteers that provide direct service to our members, but we have probably another 70 or more that help run the village and coordinate events and things like that. Excuse me. The number one request that we get is for rides or transportation, either to doctor's appointments or medical appointments, or also just social events, or to go to the store, because people still need to go to the store after they stop driving or decide not to use their car anymore. And the full service members, that we have several different statuses, full service and social members, et cetera, but the full service members can ask for up to 3 tasks each week. So you can imagine there are people that use that to the maximum. So got to go to the dentist, then I got to go to the hair salon, and then I need to go to the grocery stores. And so it keeps those 30 volunteers going on a regular basis. I think I want the next slide, please. There you go. Well, that's the other. Okay. So here are some benefits that I believe are the big ones for being a member of a village and providing these services to people. It definitely enhances socializing and interaction amongst people. It helps, obviously, with household tasks and transportation. Social events, I think, are really important, and this is an example of one of our 1 month of events. And as you can see, with some exceptions on weekends, every day there is something that is going on that you can choose to go to or not. There are at least 3 coffees each week, which are very sort of passive in nature, and you can go and sit and chat with people, or you can just go and listen. There are also things like mahjong and sort of international discussions and card playing, etc. So there's always a lot going on. in the village. What else? Let's see. We also have, as part of the village, what's called a vetted vendor network. All of the members will, on occasion, either have a roofer or a plumber or an electrician who comes to their houses and does either a good job or a bad job. If they do a really good job, we ask them to call in the office and say, this is my electrician, I think he was really great, here's his name and here's his contact information. Then we'll look into them, like through the Better Business Bureau, et cetera, and voila, we end up with a list of all kinds of service providers that people can call in or access on our website for who's a good vendor. So that's why we call them the vetted vendors. One thing I'll just note that was, I think, kind of iconic for this village was that during the pandemic, while other villages were losing members because nobody wanted to go out and they didn't want to pay the money to be a member, we ended up increasing our membership. And I think it's because we really did a good job of reaching out to people that would otherwise have been very isolated. We actually called all of our members to make sure that they were able to understand were able to make an appointment to get a vaccination, and if they weren't, we helped them do it. Some of us woke up at 4 o'clock in the morning to see if there was an appointment at Safeway within the next couple of months. And then we also called them to say, how now will you get to that appointment? And if they couldn't get there themselves, we drove them. So during the pandemic, we showed that we really cared about people, and they stayed with us, and they invited others. And that's how we ended up at over 200 people. Let's see. Some of the other events, just to sort of underscore it, we have a biking group, we've got a hiking group, we've got 2 reading groups. Messy art is very popular. 3 weekly coffee hours, as I noted, a cards group. We have a French-speaking group, as well as a world cultures group and a mahjong group. So it's all everybody's doing something every day. Let's see. I'm just going to give you just 2 examples of people that are, I think, memorable members of the village. One, let's call him Tom, joined the village, and he said when he did his intake, I do not want to be part of any of your events. All I want are the rides. And he was a little bit snippy about it, so we just let him be. And lo and behold, about 2 months after he joined, he started his own card group, and it is wildly popular. He plays maybe twice in a month, like on a regular basis. And he's got a regular following, and he now comes to all of our events and whenever we get together. So it sort of changed his life, I think, a little bit. And then the second example, a little bit more sort of in-depth, Annette and Wilbur joined the village probably in 2016, so right after we opened. They were both in their 80s. And they joined because Annette had been diagnosed with Parkinson's disease, and Wilbur wasn't really able to drive that much, not very far, and so they needed help getting out and getting to places that they needed to go. They received weekly rides to doctor's appointments when they needed them. They had yard work done in the spring and the fall by groups. We have yard parties, so 4 or 5 of us will get together and we'll get things done that they wouldn't be able to do for hours and hours. And then through participation in Eastside Village events, they met a number of people who supported Annette, both through the later stages of her life and helped Wilbur deal with the loss of his lifelong partner. So I think that was a very successful story for them, and they still have only the most positive things to say about it. My involvement, just so you know, I was the chair of the original group of people that started the village. I have done direct service for the last 11 years for all of the members of the village. And then I've also been the volunteer coordinator. So I've seen a lot of our members go from living independently to either moving to residential care homes or cleaned out some homes of people that have passed away while they've been in the village. And then I've also assisted personally friends of mine who have been diagnosed with Alzheimer's and need to figure out what they're going to do next, and really hadn't planned on that before they were diagnosed. So I've seen a lot of people in different parts of their life, and I think I know what I'm talking about when I say people really need to start planning ahead a little bit earlier than they usually do. So next thing. That is to say, there are some services that the village, or none of the villages, actually do provide. And the big three are we don't provide legal, medical, or financial assistance. So all of those things have to happen outside the village as it is now. We don't necessarily help people plan for a future as they're living in their home as they age. And we don't necessarily help them directly find care homes if they need it or if their partners need it. We also don't help them prepare for illness or death before it occurs. So we are responsive, but we're not necessarily proactive in that way. And while Eastside Village is focused on helping people age in their homes, we experience quite a few people who have failed to plan for what happens when they can no longer do all the things that they could do when they were a little bit younger. So I would say that as people age, orchestrating a move can be overwhelming. I've seen it just be stultifying for people. Not only is it overwhelming, it's just physically hard for people, especially people that don't have any children or people that can help them. And then for couples, I think a plan needs to be in place for what happens if one person takes ill and the other one is remaining. Who will move? Will that remaining person move? Will the well partner take care of the other if they're just sick and still with them? What services are available to help you in your home? And I think we're going to hear more about that from Lauren in a little while. And as the instances of dementia and Alzheimer's are increasing, what if a caretaker partner is taken ill or passes away unexpectedly? What plan is in place for the surviving member or the surviving partner that has dementia? And I'll just say, recently, I'm actually in a caregiver support group, and the person that was our coordinator recently was diagnosed with cancer, and she had to be in the hospital for several days. And her husband has Alzheimer's. And while she left him in the care of her sister, which I'm sure was fine, I was thinking to myself, and what if you don't make it through this surgery? And I never asked her because I thought that would be intrusive, but it made me wonder, like, what happens to the person after that? They own a home together, and he has no other caregivers other than her. So just brought that up. One more slide, Kellen. So some things that I thought about while I was putting this talk together were things that you might all want to consider in addition to, maybe you want to have a village. Maybe that's something that you really want to focus on. In addition to that, I would say, what about, for instance, workshops to assist people in aging in place, similar to the one that it sounds like you just had recently, to make aging in place safer and planning for next steps in your life? Or developing a worksheet, for instance, that could be sent to seniors that are interested in having it with a prompt for accessing help with next steps. A resource room, maybe at a community center that is either staffed by paid staff or by volunteers. And then finally, for those of you that have accessed Medicare over the last couple of years, there's a volunteer organization that's called SHIBA that is usually organized by the county in which you live. It's called the Statewide Health Insurance Benefit Advisors. And what that is a group of volunteers that can sit with you one-on-one and talk about those pages and pages of Medicare health insurance that are available to you and your family. And what I found when I accessed that was that the volunteers were in some cases, more helpful than the paid staff that they had from the health insurance companies, because the health insurance companies want to sort of push you towards a particular outcome, whereas volunteers just want to find out what is it that you need and how can we help. So a concept like that where you go to someone and say, I'm living alone, I'm out in the middle of the country, I don't drive anymore, and I'm not really sure what my next steps are with selling my property or moving, et cetera, and have somebody just talk that through with you. So those were sort of my concepts, and I'll say just in summary that we all do need to stay active and engaged as we age, and villages have, I think, been very helpful and shown that they're very effective to fill this gap. But we also, while we're aging, I think we need to be thinking about the next stage of our life and to have a plan in place before there is a crisis. And I look forward to talking with you more at the tables, and I think Lauren is up next to talk more about services that are available. Thanks so much.
Thank you so much, JoAnn. Yeah, you mentioned, I love your suggestions because we already kind of have a few that we are planning in that respect. I mentioned that I'm Dead Now, What book? There's also an organization locally called the Peaceful Presence Project. They are going to be organizing an end-of-life planning workshop at Five Pine in the fall. If you go to the website that we've listed at the top here, or the QR code, you'll see more details about that. Registration isn't open yet, but you can subscribe to their newsletter to be informed about when that's happening as well. I know also a couple people reached out and said that they were local Shiba advisors who might be living in this community and able to assist with that. Any of those folks in the room? Any Shiba advisors here? Okay, well, also on this website, there's a link to where you can find Shiba advisors, so just keep this in mind again. All right, with that, I'm going to invite up Lauren Lebien, who's the Community Engagement Manager for ClearPath Healthcare, formerly Hospice of Redmond, and I'll get your slides loaded. Let's give her a round of applause.
Thank you so much. JoAnn, that was very informative. Thank you for sharing all of those ideas. Good evening, everybody. My name is Lauren Lebien. I'm the Community Engagement Manager at ClearPath Healthcare, formerly known as Hospice of Redmond. I oversee our volunteer efforts, our transitions program, and our community outreach for our small nonprofit healthcare organization. ClearPath Healthcare was founded by a group of volunteers in 1979. Sitting around a kitchen table, they all noticed that we needed more end-of-life support here in Central Oregon. And while we have grown significantly since then, our heart remains the same. As a nonprofit, we are mission-driven, so every resource we have is reinvested back into the community we serve, helping your neighbors and friends. Before starting at ClearPath about 2.5 years ago, I worked for many years in the Valley, running an independent living community which also offered assisted living and memory care. My job was to help residents find the resources to fit their specific needs, and I saw firsthand the relief on a family's face when they realized they didn't need to solve the puzzle alone. Helping people access the right level of support, whether in a facility or in their own homes, is my passion, and it's why I'm so proud to represent the mission of ClearPath today. Ultimately, the best care starts long before a medical need arises. It begins with a clear plan. Next slide, please. All right, the reality of the maze. I want to share with you that navigating senior healthcare is notoriously confusing, even for those of us in this industry. When you're in the middle of a health crisis, the industry can look like a labyrinth where every door looks the same, but it leads to a different set of rules or costs. For example, the difference between home health and home care is one of the biggest points of confusion. Home health is medical. It's ordered by a doctor and covered by insurance. This is short-term nursing care for homebound people. Home care is non-medical. Think of it as extra hands for cooking, cleaning, or bathing, and it's typically private pay or covered by long-term care insurance. Sometimes home care companies can also accept payment through Medicaid. Hospice and palliative care are neither of those things. But sometimes our services overlap with home care, but never home health. It's confusing, right? Occupational therapy is also for everyone. It isn't just for people who are employed and working. It's for people wanting to make sure that the occupations of their daily life are maintained. So navigating your own bathroom or managing your medications. As you can imagine, understanding how these are paid for, whether through Medicare, Medicaid, or private pay, can be a full-time job in and of itself. But there are experts out there to help you make the best decision that you can. We often hear that people need a plan, but rarely are we told what that actually looks like or who should be at the table. There are experts out there to help you make the best decision you can. And it makes sense why people are overwhelmed. The issue is not that everything is one size fits all, because it isn't. What works for your neighbor might not work for you. If you hear anything from this talk, hear this. There is no wrong door to access the information that you need. Most people in this industry would guide you in the right direction. If you aren't sure where to start, you can always reach out to us at ClearPath. Or any of our community partners, like the Council on Aging is a great resource, and we will help you find the right path. You don't have to be the expert, you just have to know that help is a phone call away. So how do you actually make that plan? Next slide, please. Closing the gaps, so the transitions program. One of the gaps identified by your group is a need for a resource coordinator or an advocate to support people with case management. And I want to highlight a service that exists to address this specific challenge. And I want to be honest with you. In my work, it's incredible how many people aren't aware of this service. That's why I'm here today. Programs like this aren't just a safety net for a crisis, they are a concrete way to make a plan and actually work it. Think of it as a bridge between where you are now and where you want to be, with a navigator walking alongside you every step of the way. Our transitions program at ClearPath Healthcare is a 100% free, non-medical, ongoing case management program for anybody in Central Oregon with a serious illness. Our coordinators function as navigators who help pull together the various pieces of the planning puzzle. They spend their time pairing people with resources they need to stay safe in their own homes. They provide eyes-on visits once a month and go much farther than just checking in. Imagine having an advocate who can attend your doctor's appointments with you and take notes so that you can better organize your next steps. The goal is to guide people to the right care at the right time, long before a situation becomes a crisis. But it's important to know that you have options. If someone doesn't qualify for transitions, I cannot recommend our partners at the Council on Aging enough. They're an incredible nonprofit resource with their own set of experts. Partners in Care is another nonprofit hospice and healthcare provider, which has a free transitions program as well, and St. Charles does too. And that's incredible. Our goal is to ensure that no one falls through the cracks. So the value isn't in which program you choose, but in the fact that you have multiple avenues to get the help that you need in our region. And it's worth noting that these programs aren't unique to Central Oregon. In other parts of the state, you might also find these resources. You just have to know to ask for the help. You don't have to create the plan on your own. Next slide, please. Primary care. So another gap identified by your group is that it's often difficult for people to travel to their doctor's appointments and that there is a lack of a local urgent care here in Sisters. And for many, a simple doctor's appointment is an all-day exhausting ordeal involving multiple specialized transportation or physical strain. The main reason ClearPath has rebranded from Hospice of Redmond is because of our new in-home primary care service. We recognize that a trip to the doctor's office is a big barrier for people to stay healthy. But there's another side to this too, and that's their caregivers. We see so many family members neglecting their own health because they're caring for their loved one and they can't leave that person to go to their own doctor's appointments. So we want to bring the doctor's office to you, serving the Sisters area as well as far west as Camp Sherman. We're working to support the whole household. So staying home shouldn't mean sacrificing high-quality medical oversight. Another thing I want to mention is the importance of your support system. As we look at these professional solutions, it's really important to remember your own personal advocates. Please talk with your doctor about your challenges that you're facing and be honest with them about what's getting harder. And equally important is talking with your support network. The SOS survey showed that over 70% of you would lean on a neighbor or a friend in an unexpected event. And that's an incredible testament to the community of Sisters. I mean, look at how many people are here today. It's amazing. But don't wait for a crisis to let your family or friends know what your wishes are. Tell them, if things get difficult, I want to explore these support programs. Or if you think that you would eventually enjoy living in a senior community, make that known now. Set up power of attorney and advance directive long before you think you'll need it, because you'll be glad you did. And I strongly encourage you to empower your support network with your wishes today so they can better support your independence tomorrow. Last slide. So tying it all together, I just want to say Citizens for Community and this SOS group have worked really hard to ensure that you can age in place. And as industry professionals, we acknowledge that this is confusing and that Sisters Country does need more resources. However, I also believe a lot of people just don't know that there are some resources available and standing by. You do not have to build a safety net from scratch. A professional one already exists. And whether you need a trusted realtor to help you who specializes in senior moves, or an estate planner, an attorney, a home care company, we have connections to help you find the right person. And our mission is to come alongside you so that we can help you build upon the plan that you're already working on. And so by identifying these various agencies and support systems now, you're ensuring that your future transitions are handled with dignity rather than in haste. So as you move into your focus groups, just know that you're building on a foundation that does already exist, and the most important step is simply starting the conversation. Let's work together to make sure no senior in Sisters has to navigate this maze by themselves. Thank you.
Hey, my turn. I only have 2 minutes, but I'm going to give you some directions. And that's my job because I used to be an elementary school teacher, and I really love giving directions, and I don't get to do it very often anymore. And so that was what I chose to do today. So thank you, everybody, for letting me give you directions. Let's see. We're going to move into the small groups in just a minute. There are 2 tables for most of the subject areas so that all the groups will be small. We'll have a facilitator and a note taker for each group. And I'd like the facilitators and note takers to please stand when I announce their topic. We have...
Should I start over here?
Lovely. Thank you very much. All right. These are going to be the affordable and accessible housing. So Stephanie Hooper and Don, actually Don's not here today, but we have, yes, Mickey and Tori are here, and Stephanie and Kim. Yeah, so you can go to either of those tables to talk about the affordable and accessible housing. And then, oh my gosh, Kellen, non-medical transportation. I have an eye appointment this week, actually. I do. Okay. Wow, really? Cookie Coots and Laura Hill are there, and their note takers will be with them too. And then we have...
Resource coordination.
All right, resource coordination. That's with Carol Zosel and Adam Kohler, because they're at the 2 tables back there. Yes, hi, Adam. Thank you. And... All right, planning for transitions. So Lauren Lebien will be back there, and also Ashley. Yes, thank you. Ashley Wales, thank you very much for coming today.
Neighbors Helping Neighbors.
And our Neighbors Helping Neighbors group with JoAnn, Herrigel, and Kirsten Angley. Thank you for coming. Right back here. And then centralized location for senior services. Mary Orton, thank you for coming. And Jill Flores, wonderful, thank you for facilitating. And other big ideas. We know that some people, we chose these topics, right, because of the feedback that we'd gotten from our listening sessions. But we wanted to make some room for other big ideas because we know people and sisters have them. And so if you've got another big idea that's not one of the first 5 that we talked about, please come over to the other big ideas and share what you're thinking about, and we'll just talk about other possibilities as well. So, okay, one more thing before you get into your small group. Have you seen these yet? No, they're at your tables. Okay. So we have these little Post-it notes, and there are 3 of them on this nice little card. And over here on the side, we need Vanna again. Yes, thank you, Kris and Kellen. So we have some posters and these lovely Post-it notes. And the questions are, I'm going to go from my notes here. Questions and suggestions. So maybe something comes up during your discussion, you want to put it on one of the posters after you write it down on your little post-it note. And then who else needs to be in the conversation at the back? And so if you can think of someone, and we certainly can, we know there are other people who'd like to be in this conversation but are not here today. And so if you know of someone else, please put their name on the board and we'll contact them because we want to talk to everybody who wants to be in the conversation about this important topic. And then the last one is for the sack lunch. Tomorrow we're going to do a little debrief with the speakers and other people who are still interested in talking about this and just happen to have a Monday noon, available. And so if you'd like to come to the hub and have a sack lunch, bring your own. We're going to just debrief on the meeting and see what our next steps are, what we're thinking, what we gathered, what information we've gathered from today. So that's what all the little sticky notes are for. And so back to directions about moving on. Okay, table groups. When you get to your group, please introduce yourself and make a name tag. I see you've already done that. Wow, what an audience. That's great. Okay, so we've got name tags. Well, introduce yourself when you get there. And so this is it. My last direction is please stand, get ready. Oh, yes, teachers always have to monitor and adjust. We are running short of time. We see that.
We can run a little over, though, because we started a little late, too. So.
We did start a little bit late, but if we say you have 25, 30 minutes, that would probably be pushing it, don't you think?
Let's try 25, and we'll check in.
Yes.
We'll rove and assess.
Yes, we'll rove and assess, and you'll have to talk quickly, so that we can do a little wrap up at the end. So we'll give you till when Kellen says. Yeah. All right. So again, it's ready, set, go.
Okay, I know that you want to keep chatting with all of your new best friends, but we're going to try and pull things back together here. So here's how this next part's going to work. We have about 13 tables here, I think. We are going to invite the facilitator from each table to try to give a 1-minute report back. What are a few things that really jumped out to you from that conversation? I know 1 minute is not very much, but we're going to try and ask you to give some of the high-level stuff. Also, recognizing that we don't have enough time for audience Q&A and everything, I just want to encourage folks again, if you want to follow up and go deeper on this stuff, tomorrow at our debrief session is a great opportunity to do so. And if there's enough appetite, we would be happy to hold more. Now, I'd like to say, or ask, is there a first victim, a facilitator who is ready to volunteer? Mary, okay, sorry. The microphone was closer to her. Mary.
Hi, everybody.
This was centralized location for senior services. There were 2 tables, so after this one, we'll go to the other one and see if there's anything to add.
We were centralized location for senior services.
Sorry, I jumped after.
No, it's good. So we talked about isolation is a big issue, lack of information, loneliness, lots of people slipping through the cracks, but if they're slipping through the cracks, how do we find them? We need a place where they can go. What needs to be built or created was, eventually we think a senior center, but in between there's lots of steps toward that, and luckily we have a board member from SPRD here who said they're really open to the idea of something happening there. So that's really awesome because, of course, one of the big barriers was real estate. Funding is another big barrier we talked about, and we also had the area of agency of aging. The Council on Aging, the local AAA here, a board member. So lots of good information. Also, Edie and Paula are also here. But we thought that there were lots of barriers, but someone needs to, if there's enough passion and interest and somebody's willing to take the lead, that it could happen. Thank you.
Thanks, Mary.
So over at our table, some similar, obviously we're the same topic, but we did talk about the need for a senior center and talked about maybe a good place to start would be actually to go to the city because we would need some help, because right now, well, you would be able to speak more to it, but right now the focus isn't really on seniors at SPRD, and that maybe a lot of their funding isn't from the city, and so we thought that might be a good place to start. And Frank, who's not here anymore, he even suggested like a group, and he even suggested he would help out and get a group together to go to the city and start that process.
Thank you so much, and shout out to our city councilors. I saw Cheryl and Sarah who are here tonight. And Cheryl, thanks for your email shortly before this. She just wanted to acknowledge that the SOS group has been engaging with City Council, including during goal setting, and that the council heard them and incorporated some senior-related goals into their next 2026 through 27 goal setting process. So thank you for being open to community engagement and feedback. That's really encouraging. All right, we've got planning for transitions at the back that is just chomping at the bit to go. So Kris, maybe, oh, sorry, yes, we'll go over there.
Who's chomping? You again? Oh, for heaven's sakes. Oh, okay. Here you go. Bring it.
Apparently the mayor is here also.
The mayor is here too.
I know.
Oh, there you are.
She said
Sorry,
that.
Jennifer. Yeah, they're just everywhere. They're dropping like flies, I tell you what.
Okay, Sarah. So we talked about transitions, which is a huge blanket, and one of the first things that I shared with this dynamic, attractive, wonderful group that I have back here is just really staying true, first of all, to what your values and priorities are. And those are the things that have served you for your entire life. So in first step, we talked about just identifying those things that are important to you: community, family, independence. So when we talked about pain points, which was what our prompt was, finding out that we share a lot of similar things. Losing your independence. So going back to what Kris originally said too, it's an interesting conundrum because we don't want to lose our independence, but when we don't put down concrete plans, we actually are giving up our independence because we will get to crisis, and when we get to crisis, we are at the will of whoever is making that decision and whatever places are available. So some of the things we talked about that were overwhelming when we thought about making transitions, finances. Finances, what is available out there? How long will money last? When do I start kicking that in? When do I start doing that? And again, how long will that last? We talked about independence. We talked about practical issues. I know that it was touched on with the villages. Yes, the villages. But we talked about how do you navigate still running your household, making your appointments, getting medical care, all of your bills coming together. So the practical part of aging in place also and was overwhelming. And then another thing that we touched on that can be difficult is the partner or spousal relationship. And we joked around a little bit about that. So Leslie was talking about when she was going to pull the plug on Riley, but but
This is a live stream, I just want you to know. So.
it is. I told her, we laughed. I said she's going to be on Dateline. But we talked about having the conversation now because typically people don't necessarily have health issues at the same time. So having an open, honest conversation now about what is best for both of you as a couple, because as we know, the caregiver burnout is very high, and so the person who's being cared for doesn't often recognize that the caregiver has burnt out. So having kind of those conversations and developing those safe words, so to speak, so that you're on the same page when you have to make a really difficult decision, you kind of feel shorn up for it. So we did a lot of work.
I know you did. And the other table that had that similar topic, Lord?
Yeah, thank you so much. So most of our table, I think they're just feeling overwhelmed by the prospect of what comes next. When it comes to planning, where do they start? You know, a lot of folks in our group were saying that they're fine right now, but what about when they aren't, you know? And I'm just concerned about what to do when that crisis hit. So what plan could be in place, and then how do they even gather the information they need to then make a plan? It's, you can make a plan, but if you don't know what's out there, how do you even begin? So we talked about the village idea being really wise, because a lot of the times when people need somebody to come in and help declutter or care for their pets or something minor like that, they don't want to pay for in-home care to come and do that 3 hours a week, every single week, but to have neighbors or volunteers who are saying, yeah, I'm able to give a little bit of my time, that's a game changer. We also talked about how a lot of people out here are rural. We covered a lot of topics, talked about transportation challenges. And then we also discussed, okay, how do we find a point person, navigator person to then help us gather the information we need and make a plan? And so perhaps there's an organization where there could be some drop-in office hours, so, if you will, like at the library or the community center, couple hours a week, and maybe that alone would be helpful, because then people could have one-on-one conversations with a community connector who knows what's out there to then make the plan. So that's where we landed.
Thank you.
Thank you so much, Lauren.
Thanks. You want to go over to Jane?
Yeah, let's go over to Jane, and we'll go to affordable and accessible housing, and I'm going to be more diligent with my timekeeping now. So I'm going to warn you. I'm going to ask you to keep it between 60 and 90 seconds, and I'll warn you when you got about 10 seconds left. Pressure's on, Tori.
Okay. I think our biggest concern here is money, financial affordability.
Oh, is that all? Okay.
That's it.
Moving on. Great.
We talked about so many of the options have sort of disappeared here, and apartments are not necessarily affordable. Our problems are sort of income-based. We have limited resources. Some of the needs that we identified, I think, though, are important. The community things that we would like to see is a more communal living situation, similar to the village, I guess, but maybe in a clustered area. Assisted living, that's something that is needed here, and memory care, which apparently I need here. So, but Peter from Habitat here identified that land that is affordable for developers is a big issue. So if you're making
So if you know any of the owners of those empty plots of land around town, send them Peter's way. Thank you. That was very succinct, Tori. A+.
Thank you. Our group didn't get to the money part. We talked a lot about land use, and that getting ADU ordinances and regulations caught up would be one pathway. That we need to look at what are the barriers to more foster care homes in Sisters, that there are 4 times as many veterans in Sisters as other counties and areas, and that there needs to be a path for that continuum as you age in place, and to also incorporate the surrounding areas in our solutions like Camp Sherman.
Thank you so much. Yeah, fun fact, 15% of those 65 and older in Sisters Country, or in our zip code, are veterans, compared to about 3.3% for the county writ large. Just over 15% for our zip code, compared to 3% for the county.
Karen's ready.
All right, we've got
Okay.
non-medical transportation.
Our group talked about non-medical transportation, and we have some STARS people in our group, which is very, very effective for medical appointments. But they're stretched thin, and that's not part of their responsibility. So things like groceries, church, social, recreational things, a drive to Settle Lake just to get out, things like that. Access to the airport, to Bend, the affordability of private transportation is a barrier. We ended up thinking that the model of a coalition of volunteers that would be available for a variety of things, picking up something at Ace Hardware that you ordered, delivering it, maybe picking up groceries, dropping them off, maybe taking someone locally to buy Mart. We talked a little bit about insurance. So it's a coalition of volunteers, a little bit like the villages, but not quite. And also the concept of vetted vendors, I think could be really, really helpful for people.
That's great. Thank you so much. Shall we go to the other non-medical transportation table? Oh, you joined. You combined forces. All right. So efficient. Thank you. Oh, we're ready over on this side with other big ideas or small ideas, crazy ideas, harebrained ideas, what have you.
And
What you got for us, Pat?
And thank you for hosting this because you had no idea what you were getting.
Absolutely not. Okay, well, first of all, we have a really good story that happened right here at this table. We wanted connection and socialization, and 3 people at this table decided to get together and have dinner and maybe start a book club. And so talk to this lady right here if you want to join in, because she's going to be doing it. Yes, you. And really, that's what we all want. We all want connection. So we talked here at this table about having dinner, book club, things like that, and we made it happen. So that's happening. Anybody who wants to join, come see this lady in the lovely green shirt. Yeah. We had amazing things. So also the buddy system is something that they talked about, which is could be seniors helping seniors. It could be younger people, intergenerational activity, helping seniors with just some basic things at home, and again, connection. The other thing is a barrier to reaching out to services, losing relevance. We all want to feel like we're still relevant, and I think a lot of that has to do with maybe getting out in the community, volunteering, using your skills, and you will feel relevant again. I think that's a very positive thing. Focusing on purpose, that makes you feel better, which was kind of my love language. That's what I like to do, help people find their purpose in their lives, and I'm happy to help anybody do that if they want to find a volunteer opportunity. Building connection again, which is what we talked about. Off-leash dog parks, because you make a lot of friends at off-leash dog parks, right? So we're looking for an off-leash dog park. So if anybody, all right. So that is so awesome. That is so awesome.
Moving on. Great.
Okay, thank you. And then I had a lady here who she's left, but she wanted to get connected with Latino Community Association, and I can help her do that, to teach. And she speaks some Spanish, so we're going to get that taken care of. And then this gentleman here, Sandy, he was talking about the 5 pillars: living, aging well, nutrition, movement, cognitive status, socialization. He's basically saying it's the 5 pillars of the community, and OHSU, he's had talks with them, are willing to create a database to monitor that so they can see how the folks and sisters are doing.
Encouraging. Thank you, Pat. Shout out to Pat, who's with Senior Advocates for Generational Equity.
Can I go back here?
Pat will have one-on-one conversations with you if you are looking to find local volunteer opportunities. So if you are interested in finding your purpose or giving back as a means of connection, talk to Pat.
I know. I see, Kris. I see what you're trying to do over there. But I'm over here.
You're next. Okay, you go ahead, Jane.
Dueling microphones here.
Go ahead, Jane.
And this is resource coordination, is that right?
It is resource coordination, and it would have been the perfect segue to talk after transitions, because we talked about there being a redundancy and duplicity of services here in Sisters, and that we need one place to go, that it would be fabulous to have a paid resource coordinator for senior services. We talked about maybe approaching the Council on Aging, like who is involved in this? Where would our resources be? And we're really concerned about the people who live really rurally and by themselves, people who don't have some of the resources that some of us do have. So how do we reach those people? And felt that, a full-time resource coordinator would be a great place to start. Yeah.
Great, thank you. And on to Adam, I think. Are you the one reporting to us here?
We have the second resource coordination table. Our through line was really about a connected community. And if we truly don't have a connected community, we're always going to be behind the 8 ball on anything related to this topic. And how we need to start inviting more and more younger generation, middle generation, and a senior generation together. And by doing that, Paul talked a lot about how we can really give back and teach the generations coming up. And by doing that, this topic becomes a lot easier for people middle-aged dealing with parents through this process, or people that are going through this process themselves, knowing that they have a completely connected community that they can go to.
Great. Thanks, Adam.
All right, we're going to do neighbors helping neighbors.
Last but not least.
The advantage to coming late in the presentations is that I can simply say that many of the things that you all have discussed were also discussed here. We had a very wide-ranging conversation. We touched on, among many other things, the need for community, sort of a place for people to get together. We talked to JoAnn about what the village in Portland does to get people together. Interestingly, a lot of the people had ideas about, well, where can I go to play mahjong? I want to get a mahjong group together, or I want a music group that can get together. And a lot of this, it seems, could be fostered by an adequate communication system whereby people with needs could be matched up with people who have time to give. And we got in a plug for the Community Builders, which is sponsored by Citizens for Community, as well as the resources that Kellen has put together where people who have time can identify themselves and find out what's going on in the community where they could volunteer their time. If we can't get a whole village started in Sisters, and we would very much like to see that happen at some point, it seems to us that we can start off biting off little pieces. Like, let's find a place that we can get together. Let's figure out if everyone is being helped. The churches were mentioned, or the faith community in general, have been very generous with their real estate for various causes. And, is that still an option here in Sisters, or do we need to find another place that people can gather together? So we didn't solve any problems, but we have the comfort of knowing that we share everyone else's concerns.
Well, I really appreciate the
can I have
biting
your
off
note
things in
sheet?
chunks mentality as well.
Thank you.
I think
Okay,
really
more
good at
on
that.
neighbors helping neighbors. Who's up? There you go.
Well, I agree that it's nice to go last because there is a lot of connection between what has already been said. And we too really talked about community connection, and as neighbors, how do we create sort of what's the directory, or some sort of resource where we know who our neighbors are, and it isn't always just about reaching out to see if they're okay or do they need help, but how do you build connection? How do you build relationships so you can support one another and you can enjoy each other? And so is there an information hub of resources where maybe there's a group of volunteers that help to create a directory, not just in communities where there's a formed neighborhood, but also for folks that are more isolated or they don't live in a neighborhood? How do we help connect them? How do we get information to those folks? Is there a person or a hub within each sort of neighborhood area that would know who the neighbors are and be able to connect? Identifying a point person around Sisters to identify those in need. Best ways of communicating. How do we help those who don't want help? Or, I think going back to what others have said, you don't want to lose your independence. You don't want to say that you need help in some cases. So how do we just build those relationships to support each other? We also thought about the churches and the communities, the hairdressers, the different businesses. How we are small enough to be a village in and of itself. And so how do we look out for each other, and how do we find ways of knowing how to connect one another?
Let's give it up to our facilitators. Thank you all so much for engaging in this thoughtful dialogue. I'm going to try and tie this up with a bit of a bow. You heard at the beginning that this community has come together when we've been faced with crises in the past, whether it was the formation of things like STARS or Age-Friendly Sisters Country, or just looking after one another in response to the flat fire, or a couple months ago when we had some flooding in town. This community continues to blow me away in terms of how we look out for one another, and I think we have the potential to do that again around these various challenges that we've heard about tonight. So I hope that this can be a starting point, not an ending point, for all of you staying engaged on this topic. It's clear that because you're here, that you care, that you're passionate, that you are either personally reckoning with these challenges or you're eager to get more engaged on them. The first step that you can take is coming to our debrief session tomorrow. You can RSVP by putting a sticky note over there. We'd love to continue the conversation with you there. You can also share lingering questions. You can highlight additional people that want to participate in this. Please consider C4C a matchmaker, same with the SOS group. If you heard something here tonight that inspired you, but you didn't get to hook that person before they ran out the door, we can help make those connections for you, because we know, I think, combined most of the people in this room. And then I want to highlight a few other existing resources that are already out there that might help start chipping away at this. Some things that C4C has been developing. One, this website at the top, citizensforcommunity.com/seniors. We have tried to consolidate as many of these resources, local organizations, opportunities for future engagement, all of that type of stuff in one spot for you. That will be a living document. We welcome your additions to it. Another thing that is immensely valuable from a directory mentality is something that Council on Aging already develops. It's called Directions. They put it out every 2 years. It's basically a directory of all the senior resources in the region. There are physical copies out here on the C4C table as you exit. Please take them so that JoAnn doesn't have to haul them home with her. Oh, well, there you go. Shout out to the Nugget for that. A couple other things that I heard mentioned that I want to highlight. One, if you're looking for ways to get engaged as a means of connection, as a means of finding purpose, we have developed a website called volunteerinsisters.org. It is an inventory of local volunteer opportunities. It's a place, if you are an organization, where you can post them, no account required, and it's a place where you can go find them yourself. You'll find that on our website as well. We've also created a database of over 100 nonprofits, clubs, churches, and other entities in town that are offering regular events and volunteer opportunities. You can find that on our website under the resources tab at the top. We call it our Find Your People database. You looking for ways to get engaged? Chances are there's a group for you. I actually don't think Mahjong is on there yet, but there's an opportunity for that. Speaking of creating spaces for groups, we now operate a space downtown. It's a community space called The Hub next to First Street Park. It is available for after-hours venue rentals where you can organize clubs or meetup. There's a writers group that meets there once a week during the day. We have craft nights. We have other things that we had a baby shower there last weekend. You're like, if you can dream it, we can probably host it for you. So keep us in mind as a venue for that. And so, neighborhood gatherings, making connections. We have a program called Land of 1,000 Picnics where we'll give you a $150 stipend to organize a neighborhood gathering. There's just one rule. You have to invite everyone within the radius that you're thinking about. That's the only rule. So it doesn't matter if it's that person down the street that doesn't want any help. You still got to go invite them, right? These are some of the things we're trying to do to chip away at this. I'm sure we'll continue leaning in and trying to distill all of the recommendations that you've given us today. But the last thing I'll qualify, we have a wonderful and amazing volunteer board who commits hundreds of hours to this organization every year. I'm the only full-time employee. And y'all already knock on my door a lot, so I'm just going to say it right now. C4C is not going to be your savior to steward all of this forward. This is going to have to be a community effort if we want to build new things. We're all going to have to pitch in and roll up our sleeves and make this happen. So this is my call to action to all of you to continue leaning in on this topic. And I have complete faith that we can provide more for our seniors in this community. So with that, let's give one final round of applause for our speakers, for our sponsors, for our partners, for our facilitators, for Kris on sound, for Starshine Childcare, and anybody else that I forgot, city councilors, elected officials who are here. Thank you so much. Be well. Yeah, take some to-go stuff. Stop by the C4C table on the way out. Question in the back. Happy birthday to you. Happy birthday to you. Happy birthday, dear Marilyn. Happy birthday to you. No candles allowed in the church or in the school, sorry, but happy birthday.